Welcome to Pharmacology Outline channel. In this video, we will talk about diverse mechanisms through which drugs exert their effects. First, biological targets. Biological targets refer to the molecules within the body that drugs interact with to elicit their pharmacological effects. This category is further subdivided into several specific mechanisms. Enzyme. Enzymes are proteins that catalyze biochemical reactions in the body. Drugs targeting enzymes typically inhibit or enhance their activity. For instance, statins inhibit the enzyme HMG-CoA reductase, reducing cholesterol synthesis in the liver. Carrier. Carrier proteins transport substances across cell membranes. Drugs targeting carrier proteins can inhibit or enhance the transport of specific molecules. An example is the use of selective serotonin reuptake inhibitors, SSRIs, which inhibit the serotonin transporter, increasing serotonin levels in the brain to alleviate depression. Ion channel. Ion channels are pore-forming proteins that allow the passage of ions across cell membranes. Drugs targeting ion channels can block or open these channels. For instance, calcium channel blockers inhibit calcium ion entry into cardiac and smooth muscle cells, leading to vasodilation and reduced blood pressure. Receptor. Receptors are proteins that bind to specific signaling molecules, triggering a cellular response. Drugs targeting receptors can act as agonists or antagonists. For example, beta blockers antagonize beta-adrenergic receptors, reducing heart rate and blood pressure. Second, non-biological targets. Non-biological targets refer to mechanisms that do not involve direct interaction with biological molecules, but instead work through chemical or physical means. Chemical. Neutralization. Neutralization involves drugs that counteract the effects of other substances in the body. For instance, sodium bicarbonate is used to neutralize stomach acid, providing relief from heartburn and indigestion. Chelation. Chelation involves drugs that bind to and remove specific ions or molecules from the body. Deferasirox, for example, chelates excess iron in the blood, preventing iron toxicity in patients with conditions like thalassemia. Physical. Osmosis. Osmosis-based mechanisms involve drugs that create osmotic gradients to facilitate the movement of water and solutes. Diuretics, for instance, increase urine production by increasing the molality of the filtrate in the kidneys, helping to manage conditions like hypertension and edema. Adsorption. Adsorption involves drugs that physically bind to and trap substances on their surface. Activated charcoal is a prime example. It adsorbs poisons and toxins in the gastrointestinal tract, reducing their absorption and aiding in the treatment of poisonings. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.